clicking the button. It should say that we are live on Facebook. That's what it says. It says it. And I see us, and we are there. Good afternoon, everyone. Welcome to Peterson's Breaking News of Trenton. And guess what? We are in for a treat today. Not only are we here for our moment with the Mayor, Gusciora, but guess what? Thomas Peterson is actually here with us in the flesh. Hey, Thomas. Hey, Mayor.
Hey, Thomas. I thought you and Thomas were one and the same.
I am Thomas. That's right.
I never saw both of you at the same time.
He is here alive in the flesh. Thomas, I'm going to yield to you. You want to greet your viewers and everything and shout your people out. I'm yielding it to you.
Absolutely. Good afternoon. I'm going to give my time to Chris because she's ultimately the best here. She runs the show here with the moment with the mayor, and I'm just going to give it to you, Crystal.
Okay. Well, thank you for being with us here on today. We appreciate you certainly and for your platform. To everybody that's watching Peterson's The Breaking News of Trenton, here he is, the young man that helped create this awesome news platform. And for those that don't know, I just want to take a minute, Mayor, because I'm sure you know, Thomas actually started this. How old were you when you did this, Thomas?
I want to say I was around 15, 16 years.
Wow.
15,
Yeah,
16 years old.
And he started riding through town on a bike. He was so caught up with the news that he started riding around town, capturing the images on his bicycle. And also, where'd you graduate from?
Daylight Twilight High School.
But Trenton, Daylight Twilight
High School.
So we have an awesome Trenton High graduate, right? Born, raised here in the city, still here, dedicated to the city, riding his little bike around town, capturing the news. And now you have Peterson's Breaking News of Trenton with over 42,000 followers. You want to talk about kicking some ass? You have done just that and then some. So congratulations to you and thank you for all you do. And Mayor, Thomas and I actually met at a Citizens Campaign Journalism Boot Camp in Asbury Park, New Jersey.
Oh.
And so this was years ago. And when Thomas came walking in the room, we were all at a restaurant. And when Thomas came walking in, he was like, "Hi, everybody, I'm here." And we're like, "Well, who are you?" And he said, "I'm Thomas Peterson." And we were like, "Not of Peterson Breaking News." And he was like, "Yes." And he was like so young because this was like so far back that it was an honor for all of us to meet you. And now it's an honor and blessing for me to even to be able to work with you. So shout out.
And I think Thomas has really captured the entrepreneurial spirit of Trenton, where a lot of young, engaging people have really just tried to forge a path for the better for Trenton. When you want to hear about public safety news or other things that are going on around in Trenton, Thomas's Breaking News is one of the best resources, and it's fair, and that's all we ask. There's too many people who want to peddle negativism and just want to tear the city down, and that really doesn't do anybody good. We just think that you do a great job of just uncovering the facts. You're truly professional journalists in every sense of the word. And that's what it all should be about, informing the public what's going on and how can we do things better. So really credit to yourself, and you got something, got something going.
Yeah, yeah. We wanted to keep growing bigger and bigger and bigger so that Thomas has his own huge platform. Where you don't even have to be going out. I mean, I know you love it. It's an adrenaline rush for you to go out and do what you do, but so that you even have a fleet of people just with you that, when you walk on the scene, eventually it is a true, Peterson's Breaking exclusive moment because you have arrived. So, kudos to you. Kudos to you. Mayor, let's get with it. COVID, what is going on? I mean, we started off, we were high and we were kind of, I think, evening out a little bit. And now the second wave, they said that it was coming. Is it here? Let's talk about what's happening in the city. what's happening as far as COVID-19?
I think what people have to remember is that the first wave was about, I'm looking from where my hand is, was here, but the second wave is up here. And it's at least 3 times as deadly as the first wave. So everybody should really buckle up because it is going to be a bumpy ride. We'll probably have three times the amount of numbers we had in the spring. And that's because COVID is also competing with the flu and just winter chills, and where people stay close knit indoors, it just becomes a breeding grounds for the virus. And it's really unfortunate. All during the summer, we had single digits of new positive cases in the city. And just the last couple of days, they were in the 60s and the 80s. The number of COVID positive cases per day. Now, luckily, the treatment has gotten better, but now the hospitals are going back into divert status, meaning that they may not have the hospital beds and they have to divert the patient to another area hospital. And it is really scary stuff, especially when medical resources are limited. And a lot of this is preventable. And shame on the current president. Hopefully he'll be resolved pretty soon. I know he conceded this morning and then took away his concession about an hour later.
Wait, I missed all of that. Oh my God.
All by Twitter. Hasn't shown the leadership that just simple things like wearing masks, keeping social distancing. The city has busted a number of illegal parties. We've had to shut down restaurants that we didn't want to shut down, but the social distancing wasn't kept, and they become super spreaders for COVID. So please don't go out to these massive parties or create your own. It's just not doing anybody good. And I know everybody's hurting top to bottom. You know, people try to pay their bills and also they just want to go out and have fun. And I don't blame them, but you know, just have fun in small groups that you can trust right now. They even said, pick your friends and just stick with a small group throughout the winter until you can get a vaccine. We are lucky that they did get a vaccine fairly early. It's 90% effective, but it won't hit the general population till about March or April. And so they're going to be doing, you know, hospital workers, nursing homes, vulnerable population like elderly, and it's of all ages. In just the last week, we had a 3.5-week-old baby that came down with COVID. We had a 5-month baby with COVID, and we had a 1-year-old with COVID. So it is spreading to young folks. And while, yes, it's true that young people, by the majority of will survive, it's still the roll of the dice. You're still playing Russian roulette. And all of us, you know, we have elders in our family, whether it's grandparents, aunts, and the like, or neighbors. You know, you're just basically can trigger something really bad happening to them, especially if they have vulnerable health problems. And all of us, to some degree, have vulnerable health problems. So we don't even really know which persons are vulnerable or not. Unfortunately, our former public works director was 56 years old and died unexpectedly. And, you know, you can go from 0 to 700 miles an hour with the virus in one day. There was a story of a 30-year-old in New York. From the time he contracted it, he was dead the next day. So sometimes you linger on for weeks, and we don't know enough about the virus to know why it affects one person worse than others. And populations of color that have healthcare challenges or have medical care challenges, insurance challenges, are hardest hit. And that's why our city is so vulnerable to the spread of this virus.
So, and thank you for that. And yeah, it is scary. And so we're seeing that, you know, we're getting some commentary Some people didn't realize that the kids were getting it right. We thought at one time they didn't.
3.5 weeks old.
Yeah, yeah. And so here's the thing though. My whole thing is with this, everybody just needs to be safe. It doesn't even matter what, okay, they're young, okay, their chance of survival rate is better. Yeah, we want everybody to be okay with this, but at the same time, everybody needs to be safe in the process, right? And then you have the people that have to work. So someone on here said that they work for Train, and now it's been that people have tested positive at Train. So, what do you do in times like this where, okay, they get it at the business then shuts down. What about the people that, they rely on this money to take care of their family? All these organizations that are supposed to be there to help, they're limited in their resources now because you have all these people coming for help. So this is a time of great concern for everybody in the community and in the nation, right? Because this is serious, but yet there are still some, even among us, that just don't take this seriously enough. So to that end, do you see a shutdown for the city in sight?
Well, on Monday, tomorrow night, we're enacting a business shutdown at 10 p.m. So we don't want to be punitive and shut down all commerce. But we would ask people and businesses to shut down at 10 o'clock. You can still get delivery or pick up until 11 o'clock. But we've asked that all businesses, particularly bars and restaurants, shut down at 10 o'clock. Nothing's going to happen after 10 o'clock if you're not going to, meet that special person in your life by 10 o'clock. It's not going to be very special in the long run. So,
right. Meet them online.
You got to be safe. And, I've gone to some restaurants and you just cringe at sometimes where people, they let their guard down, they go to the bathroom without a mask on, or they flaunt not wearing a mask. And it just makes it more and more difficulty. They're in, I believe it's North Dakota. They have such a medical shortage because people are getting infected. They're even allowing nurses with asymptomatic that had no signs but still are positive to continue to work. And that's talk about playing with the loaded gun.
So you're not even safe at the hospital.
Yeah.
We're not safe anywhere. Oh God.
No.
Listen, so I mean, people, we need to really take this serious. Let me see. We had a couple. Someone asked, can you list or can you tell us what type of businesses specifically are going to be shut down, or is it going to be a repeat like you did the last time?
All retail businesses have to shut down by 10 o'clock. So corner stores, everything needs to shut down. Food markets, restaurants, bars particularly need to shut down by 10 o'clock.
Okay. And what about free testing sites? How's that going?
Yeah, the county is doing one at Cure Arena on the 23rd.
Okay.
Tomorrow, we're going to expect an announcement that we're going to have a test site, a pop-up test site within a week. The problem is you have to get a vendor who come in that have the equipment, have the test kits, and have the ability to analyze them. The requests are going through the roof by all these agencies and outside entities. So we wanted to have one this weekend. We were told that none was available. We said, how about next weekend? And they said they'll let us know Monday. So,
oh my goodness.
It's really tough. And we're getting back to test kits are going to be, try to go to one of these urgent cares. They're all now booked. And one of my staffers went to get a test and they said that we'll set you up an appointment in 2 weeks. And it's just, there's just not enough stuff going around. And unfortunately, we didn't have a federal government that has been preparing us for this second wave. 3 times the first wave.
God. Thomas, you wanted to talk to him and ask about something yourself about the parks or something like that. What did you have?
I did. So the governor rolled out the new restrictions, just like in the beginning of the first wave. It was the beginning of, closing everything back down.
Mm-hmm.
Could we see the parks and everything else closing back down eventually again as well?
Yeah, we're just encouraging everyone for passive recreation. So if you want to bike ride through the park or ride your bike or shoot hoops by yourself, that's one thing. But to have any of these organized sports or family outings, we're trying to really discourage that. We're not putting it on ironclad, but we're not trying to be as restrictive as we were, because a lot of people complained because a lot of people in the city were adhering to these social guidelines that nobody was contracting COVID, right, but now they are in waves. And I could see this pandemic going right through the city, unfortunately.
Wow. And so right now, you're saying that we'll start in tomorrow, you're going to announce the retail businesses and restaurants shut down at 10 o'clock.
Yes.
If this thing continues to move, right, through as it's projected to move throughout the city, what is the extremity of this? Like, what will it ultimately be? Where does it move from it being shut down at 10 o'clock? What then, down the line can we expect if people don't adhere, if it keeps moving, what can we expect to happen beyond the 10 p.m. closure, if anything?
You can see curfews, but we want to avoid them. But if people are going to be congregating on street corners or outdoors and having these parties, we'll have no other choice. So we don't want to have a lockdown. I don't think anyone wants to have a lockdown, but the thing could be a lot easier on all of us. People would just take the mask seriously and don't wear it under your nose. I know it's uncomfortable, but as the governor said, so is death. Death is uncomfortable.
Well, death, you ain't feeling nothing. You're dead.
Well, getting there.
You're done. You're done. It's over.
Well, depends on if you're going up or down.
Right, I guess, yes. But it has a lasting effect on the loved ones, that you leave behind. It's really devastating. In all seriousness, I'm not poking fun at everybody. I'm just saying.
We've seen it all. Think about it. All of us are starting to, in the spring, we were able to say, well, I heard somebody had it, or somebody's great aunt who lives in Texas had it. Now we're starting to actually say, I actually know somebody that I had dinner over their house died. And I could raise my hand if that question was asked of me. So we're starting to know people that have actually died of COVID. And, it's got to be a warning to, we all have to do better. We have our health director that just joined us.
Right, she just popped on. I only called her 3 times. I only called her 3 times, and now she's on. So everybody, let me introduce to you, we have Yvette Cooper. She is the health officer for the city of Trenton. She's joined us here on Peterson's Breaking News today. So Yvette, we are live right now and we are rolling. The mayor has been briefing us about COVID-19, what we can expect, what's going on. But so the people can hear it straight from you. And we thank you for meeting with Thomas and I today. So this is a special day because Thomas is actually here with us as well, which is rare, right? Because he's always busy catching the latest and greatest news story to bring it to the people live. What is going on? Tell us your
Yvette has developed a reputation of being the meanest person in City Hall, but for good reason, though. I mean, she is tough. You do not want her showing up at your establishment because she comes on with Ghostbuster uniform, and she first sprays you and then she yells at you.
She even sprays you, Mayor? Does she spray you too?
I was in my office and Hawk came in with the Ghostbuster spray gun and just sprayed. And
in his own office?
I was drinking a cup of coffee and he's like, "Hello, man." And I was like, "Oh, thanks, Hawk, for that."
Whatever we have to
coffee
do.
Anyway, it was the cleanest cup of coffee I ever had. It was like
whatever we have to do.
Like the mosquito control
Right.
in my office, but
For good reason. All right, so Yvette,
yes,
you have sprayed down the mayor. You have you come in with your Ghostbusters outfit on to make sure that everybody is safe, and so we're glad that you do. Thank you for all the precautions that you take, right? Because ultimately we need her to be safe so that she can keep doing what she's doing to make sure that everybody else is safe. So speak to the people now. Tell us from your perspective, COVID-19. What is going on? You know, what can we expect? What do we need to do? The mayor has briefed us all. He's given us really great advice about wearing our masks and what's going to happen as far as the businesses shutting down and things from his perspective. But now from your perspective medically, talk to us about COVID-19.
So, and thank you for having me. I heard the phone ringing, but I was on some other contact tracing calls. I apologize for being late. Right now, I mean, we knew from the beginning in the middle of summer that we were expecting a second wave, for which I believe we're in right now, when we'll see the peak come around Thanksgiving. COVID-19 right now, I think that it's a community message where there's a lot of individuals that weren't taking it as seriously as they should have been taking it. This is one of the disease that we can reduce the spread by just following some simple directions: social distance, wear your mask, stay home if you're sick, no gathering, and just do that for yourself and for your neighbors. This is not one of the disease that is all about any one individual. Whatever we do with this disease affects the entire community. So we're asking the community to love your neighbor, love your family, love the individuals that you know, this is something that we have to do together. I cannot be wearing my mask and you don't wear yours. So this is a community effort. To reduce the spread is a community effort. Everyone has to do their part. And this is something where everyone has a part to play. You know, there's a lot of times we talk about, you know, doing something for the community. This is the greatest thing that we can do for the community, which is wear your mask, social distance, wash your hands, you know, don't travel to the states that are high with COVID, you know, talk to your family. When you keep your family safe, you're keeping mine safe. So we are doing this together. Right now, in the beginning, this was, you know, we heard it was all about the seniors. That scenario has changed. Like I sent to the mayor, we have a 3.5-week-old, we have a 4-month-old. You know, we have babies, we have infants, we have under 18. Those numbers are rising. And now that it's getting cold outside, you know, and everyone is now going to be gathering inside, we want everyone to stay in their own homes. Another problem that we have is if my mom comes to visit, I'm thinking, because that's mom, you know, we don't have to wear masks around each other, but we do not live in the same household. And if you don't live in the same household, you need to be wearing your mask at all times. Inside, outside, try to do the social distancing. Thanksgiving is coming. I'm encouraging everyone to do it virtually. You know, we can show our love at Thanksgiving best by staying away from each other. This is one holiday that staying away is the best thing to do, not gather. So, I mean, you know, as we go into this second wave, it's going to take a community effort to get us through this. There's a lot of individuals that were asymptomatic in the beginning. We are seeing more individuals now are showing symptoms, but then we're also concerned about the ones that shows no symptom and just believe that because they have no symptom, they're in the clear. Those are the ones that we fear the most, because you know, individuals are not running away from you because you're not sneezing, you're not coughing, you don't look sick, so you think it's okay. We just want to spread the message that the virus is here, it is still here, and it's going to take all of us together before we can, get a handle on it. And the entire community is encouraged to do their part for themselves and for their loved ones and for the entire city of Trenton.
Wow, thank you. Yeah, you know what though, in all seriousness, from what you're saying, never has a sneeze or a cough been more serious to me than now. Yes. Like, if I'm out and about, you know what I mean? Especially, I could be like an aisle over, and if I hear achoo, I'm like, oh, you know what I mean? Like, I mean, I got my mask on, but you don't know, like, oh God, I need to run that way. Or if somebody, you're like, and then people just look with the nasty stare, like, come on. But, to your point, we do just need to be safe. But off of what you said, Mayor, a lot of people are requesting, and I get it, right, from having the children, and you want your kids to be able to socialize and be out and all of that good stuff. I understand. But they're talking about, open up the centers, put the kids in, let them go over there. What now do you say to that? I mean, I know we've been saying like, no, but now with this happening, what do you say to that?
Well, we tried that, and we had an outbreak on our men's soccer team and our football team. And I don't think, Yvette is one of the hardest working persons at City Hall, and I'm not making light of that. And I don't think she enjoys confronting nursing homes, businesses, restaurants, private parties. But that's her job, and she has the expertise and the medical background that she knows more than anyone what this virus is all about. And I mean, she has to study it, keep up on the information, and we have to entrust. That was the problem with our president. He doesn't even listen to his own healthcare advisors. So, Yvette will tell you, I want to keep as much stuff as open as possible. And she's like, you got to shut it down. And, we either want to follow the science or we want to follow our hearts. And, we try to meld the two. If you really care about your loved ones, you're going to isolate yourselves and not do dumb things like go out without a mask or not wash your hands and, try to think that, that this is not going to affect me. But it just one exposure and then, it's too late when you realize, oh, darn, I should have worn my mask.
Right. Okay. So Yvette, Darlene asked the question. She says that she was told that once a person has COVID and they recover, they then become immune to the virus. Is that true?
Not completely. We have had individuals that had the virus and later got a negative test. 2 months went by, they got reinfected, end up in the hospital on a respirator. So no, that's not entirely true. You can get reinfected. And I think right now CDC is working on just finding out what percentage of individuals do get reinfected. So I would not say that you develop an immunity to it. Some individuals may, but that would not be universal for everyone because we have had reinfections.
Okay.
And the other danger, Crystal, is that there are people that recover, but not completely. They may be negative, but they still have respiratory problems.
Yeah.
They have difficulty walking up steps. They have difficulty outdoors, taking a hike or manual labor. So we don't even know what the permanent damage is once you get
correct.
COVID. And it's not this 3-day cold that the president claims to have had, but for the fact that he went in the hospital asymptomatic. They told him, walk out of the White House now because, you're expected to be carried out. And he had the best medical care in the world. And, none of us on this page have the best medical care in the world. We all have to wait in line just like anyone else. So you don't want to catch it,
right?
Or give it
Thomas?
to anybody else.
Director Cooper, so this question is for you. As I've been hearing your name a lot with the phone calls I've been receiving, I've been getting a lot of phone calls about the welfare office from their employees about COVID cases. And specifically, they've been telling me about your name.
What's the question?
Yeah, about the COVID cases. Yeah, it's a lot of COVID cases there. I think my phone froze. Yeah, I think my phone froze for a second.
Right, I'm like.
Yeah.
So without disclosing any personal information, I did make a visit there, observe some things, had a 3-hour visit. We toured each floor, spoke with the individuals in charge and made some recommendations. I was told there was 470 employees in the building. We did make some recommendations for the AB schedule for them all not to be in, so that if one person gets sick, it doesn't wipe out the entire facility. But the thing with that facility is that they are an essential service.
Right.
There's a lot of families that depend on their services. So I know that there's a lot of workers that wanted the building to be shut down. But then if you look at the guidelines, there are certain services that we provide to the public that are essential, that we have to keep open, that we have to be sure that we do, because families are dependent on it. So when I went, I did make the recommendation for them to have the AB schedule. I made recommendations for, the plexiglass to be around each individual. We talk about bubbles that people to be in, how to separate them. We talk about everyone need to be wearing their mask at all times because of how close the desks were. I mean, I gave them recommendations on what need to be done. And then I also looked at the individuals that were positive and those that were closest to those individuals. I made recommendations for quarantine. And also for the building to be sanitized, which they did. And then for those that can return to work to continue to provide these services to the community, I recommend that those individuals return to work. But I know that there was a lot of folks that weren't happy with that because, I know that there's fear and no one wants to get sick, but I would hope that they would trust the information. I went there with the county health officer and my communicable disease nurse. So I would want them to trust the information that we gave. I would like them to trust the fact that we're doing everything that we can in their best interest, and that the recommendation that we provide is the safest one that we can provide for them and also for the services that they provide. So there are some cases, there were some things that needed to be changed, and the recommendations are in, but also we have to give them the opportunity to fulfill those, to implement the recommendations that was made. So if they have to put up more plexiglass, we have to give them a chance to order them, to receive them, to make appointment, to have them set up. And I know that the day after I left, I was getting a lot of phone calls. And that's the message I'm saying, like the recommendations were made. So you have to give them a chance to implement, and then we'll go back and revisit to make sure that it's been done. So we are working on it diligently to make sure that everyone is safe and everyone is going home safe to their families. But again, like I mentioned when I was there, when I was walking the halls, I saw individuals that are walking 3 and 4 in a group. They don't live together. And the message is, if you do not live in the same home, you still need to social distance from each other. So I made that recommendation also. And I suggested that individuals at some point, we have to take the responsibility for our own health. So if I'm walking down the hall and you're too close to me, I'm going to give you the eye, like back up. Or if I walk in a room and there's too many people in, turn around and walk out. I mean, we have to take some responsibility for our own safety, for our own health. And if everyone is doing that, then we'll have less individuals being infected. Don't be walking down the hall with 5, 6 people, because these masks that we're wearing, if you look at the research on the mask, the N95 mask that is fitted to your face is the best one that could give you the most protection. All the others have a potential of having particles come through their material, especially if you're wearing the cloth ones that you're not washing daily, that you're not sanitizing. You still run the risk. They're not 100%. So we still have to do the social distancing. Wave your hand and say hi from afar, use your technology, call them, you know, do high fives from 6 feet away. Those are some of the things that I mentioned for them to get done.
So I have a question off of that, just for the people that are watching, right? So we see the mayor when he has his mask on, and typically it is the N95, or he has his other mask and everything. So now, from what you just said, for those of us that would wear a cloth mask and move around, it goes even beyond just wearing a mask, period. Because now, based on what you just said, the N95 is the best mask that would protect us all. Those aren't the masks that everyone is getting. We are just getting some kind of covering. So for everybody watching, you know, I hope you caught that and that you listened to that. So again, and then if we have the cloth mask, we need to be washing them regularly, right?
Yes.
If you're going to reuse it, to make sure that you're okay. So it's even beyond just putting something over your face.
Correct.
It's actually putting the right thing over your face, which goes to the point about just stay home if you have to stay home, because either way, you know, we're all putting ourselves at risk with this thing. Mayor, Chad asked the question. He said to you, what? Wait a minute, and I marked it off on here so I could try to come back and catch it. What other further steps would you take if you had to?
We would.
I'm glad to be a part of the change.
Wait a minute, go ahead.
We would lock Chad in his room, first of all.
Right.
Yeah. And bolt the door.
That's it, with one mask.
We don't want to necessarily take any more actions. I mean, people have to take personal responsibility, and we can't, you know, Thanksgiving is coming up, as Yvette said. We can't tell you that, you know, unless you live in the house, you can't have guests or have family to come in. We hope you won't invite people from out of state, particularly those that are on the travel advisory. That's not going to do either one of you good. And we're not going to recommend you travel to a state that's on the travel advisory. But, you know, people are going to have to take their own personal responsibility and be safe. And Yvette's right, wash those cloth masks. Don't wear those bandanas. I see a lot of people that, you know, just wrap an old handkerchief around their face, and that's not really a mask. So, you know, really follow the science. You know, Google it, just don't Google any scary groups. You know, but follow the science, what the CDC says, what Dr. Fauci says on television.
And something else too, Mayor, that is very important is that you can't share a mask. Individuals are sharing masks. Oh, you cannot share a mask at all. And that is a big problem, where you can't just take it off and somebody else puts it on, whether or not you're in the same household. These masks are not to be shared. Some of them are one-time use only, and definitely do not share the mask.
Go ahead.
If there's individuals, I mean, I do have a supply of masks in my office, and I travel with them in my car. I hand them out to individuals I see that have no mask on. You know, I'm pulling over to all kind of folks. I become the police on the street with the mask. Like, I am literally out just making sure people have the mask, but you cannot share a mask. That's a big problem, that you cannot share a mask. And something else that is being done is, if you are driving in your car alone by yourself, you really don't need to put the mask on while you're in your vehicle. You put it on when you leave the vehicle, or if you have others in the vehicle, then you put it on. But I see a lot of folks driving around in their cars by themselves with a mask on, with the windows up.
Maybe they figure they might forget if they get out with it. I mean, I don't know. You know, I don't.
But that's not a good practice. That's not even if you pull it, this is a time that you could pull it down on your chin then when you're driving, but you don't want to be in the car. It's winter, the heat is on, you know, windows up, and you have something blocking your breathing while you're driving. Put it on when you get out the car.
So there's a two-part question, right? One is, You also can get corona in your eyes, but we don't really cover them, right? So I want to speak to that briefly. And then someone says all these masks come from China. How do we know that the virus is not in the mask and we just put them on our faces? So let's speak to the part about the eyes, right? And short of us all, I don't know, how do we stop that? Is it just enough with just the washing of the hands and not touching the eyes? You know what I mean? Should people be wearing like some kind of goggles or something over the eyes at this point? Should we all be walking around with the face shields on at this point? And then to the point of the mask coming from China, does that really mean anything? They're individually wrapped. What do you think? So go ahead and speak to that.
So the three avenues of getting the virus, you are correct. It could be your eyes, your nose, and mouth. But we also know that the nose and your mouth is the two more highly areas that you can get it. So you, with your eyes, with your mouth, you're open, you're speaking, your nose, you're breathing, you're taking it in. With your eyes, not so much. And if we can wear shields to cover our eyes, but if we are 6 feet away, they talk about how far the virus can travel when you're speaking or sneezing. But there's not a lot of research that shows that, you have to walk around with a face shield on unless you're in a hospital where someone is highly contagious. So no, I wouldn't recommend you walk around with a face shield on, but definitely cover your mouth and your nose, which is the two fastest avenues that the virus can get into your system. Again, also when you wear the shield, depends on which shield you wear, you still need to have a mask on because of the openings that the virus can get through. So yes, wear the mask, do your social distancing, and that will be enough unless you are in a nursing home, a hospital, someplace that you know that there's positive cases. In regards to the mask being from China, the research shows that the virus can only stay on certain surfaces for X amount of time. So for example, if it's say cardboard and it says it's on a cardboard for 24 hours, and you get a mask coming from China, I'm not sure how long it takes to get here from China, but no, I wouldn't be worried about the mask coming from China because the virus can only live on certain surfaces for, 24 hours, 3 hours, 3 days, depending on what the surface is, it stays on certain surfaces longer. So no, I would not worry about where they're coming from at all.
Okay.
Another thing,
One more question. Go ahead, man.
One other thing, the reason why we know that is we have tracers, skip tracers, where I think Yvette has traced all the viruses to another person.
Yeah.
And by people going into groups or associated with another person. So the transmission has been really traceable to another person.
Yes.
We haven't had a dead end yet that has gone to a mask.
Okay, so that's good to know.
Sharing it and doing
Right.
things with it.
Right. So back to that sharing point, Yvette, we're going to ask you one more question. The question that Meg had, just for clarity, when you're talking about sharing of the mask, she said you're talking about the disposable mask, right? Like, so if somebody has a cloth mask, I have my daughter, I wear my cloth mask. Let's say I come home, I throw it in the washing machine, I wash it. My daughter wants to run out the door real quick. She happens to like that design on the mask, so she snatches that mask that has been washed and dried. Is that okay?
So the sharing that I was talking about is we're talking about individuals that are going to the corner store and somebody don't have a mask. So I go in with the mask, get what I need to get, come out and give it to the person who needs to go in next because they didn't have a mask. That kind of sharing. If I take a mask off and hand it to another person, no, that's the kind of sharing. If you sanitize and you wash your mask, now that mask comes out as a brand new mask. So yeah, I have cloth masks at home too that my kids love with my little Jamaican designs on them. But you need to sanitize, clean them, make sure that they are washed. We don't want you sharing a mask that you have worn and then giving it to somebody else without properly sanitizing and cleaning. Because yes, there's some of them that are reusable. So for those, no, those are not what I'm talking about. We had a call that, one of the merchant told us that he has seen individuals go outside, gave their mask to someone else because they wouldn't let them come in without a mask.
Right.
So that's the kind of sharing that I'm talking about.
Oh, okay, okay, awesome. Yvette, before we let you go, if people have additional questions about what's happening with COVID or whatever, do they call your office? Is there a number that they could call, or can you give that to everybody, please?
Yes. So the number to my office is 609-989-3242. I have a total of 7 contact tracers who are nurses. I have 2 communicable disease nurse and 4 other nurses. Everyone that picks up that number is qualified to answer the question, but you're always free to ask for me directly. My extension is 171, and I'll be glad to answer any question. I also have a work cell phone, but that sometimes get a little bit too much, so I'm not going to give you that. Just call the office, and
this is fine.
call the office, and
they'll be calling you at midnight. Hello. So,
that's going on now. My latest call so far has been 2:47 a.m. So yeah, wow. I can definitely do without that call. But yes, call the office at any time. My extension is 171. Leave me a message. I'll get back to you no later than 24 hours after you call. If it's urgent, then my office staff will give me a call on my cell and leave your number, and I'll call you right back.
Awesome. Thank you, Yvette, so much. We appreciate you taking time. We're just going to wrap up with the mayor, and we'll have you certainly come back again and talk to us, because you gave us a whole lot to think about and to digest. So we thank you for coming out on Peterson's Breaking News today. Yvette, we'll be talking to you soon.
No problem. Thank you.
All right, honey. Thank you.
All right.
Mayor, wow. First of all, for me, I don't know about you, Thomas, but for me, it's reassuring to know that you do have someone on staff that is in tune to what's going on, because this is serious. And just listening to Yvette and everything that she had to say and the information and advice that she gave us, even though it's basically stay home, she's available and ready, and to know like that she's actually going out into the businesses and into these places dealing with this head on. I didn't even realize that was some of the functions, you know what I mean, of what it is that she does. So to that end, I guess I'm kind of happy. I mean, I'm not satisfied with the virus, but I mean, it's good to know that there's people around that we can turn to, I guess, if we need help. But to that end, about what we talked about earlier, about being able to be tested or being able to get, the people with the pop-up testing and things like that. What are we doing about getting, what are you doing actually about getting more kits and stuff? I know you're saying about having the vendors and stuff like that, but what is the city doing, to try to make it so we have these kits and stuff, these tests available for the city, for the residents?
Well, we've been ordering them, and like I said, the county is going to do a free testing at the Cure Arena on November 23rd, and look to an announcement by us. We're going to do a separate one. The Housing Authority is going to do one in Donnelly Homes. So we do want to test as many people as possible so that they know whether they have it, and that they could take precautions to make sure that they don't spread it. So we're doing our part to get the testing available. You can still go to the drugstore, CVS, Walgreens. You can go to the urgent care on North Olden. You can go to the one on Campus Town in Ewing. So there are places you can go privately, but we hope to have citywide ones available in the coming weeks.
Okay. And what about for the senior citizens? I hope Miss Janice doesn't get me, but she asked a question where she said, where can she go get a walk-in test? Are there any provisions being made for senior citizens if they need to get a test? Like Miss Janice, she wants to go get a walk-in test done, right? Where can she go now to get a walk-in test done?
she should go to the local pharmacy. She can hook one up there or go to the urgent care. Yvette has visited all of the senior towers. We've been giving out face masks to seniors. So we're getting the word out. There's just not a location that are just being done for seniors. That's a possibility in the future. We'll just have to see how it goes. And again, we have a federal government that did not prepare for this, so supplies are getting tight again. And,
Right.
you know, the hospitals want to get those PPEs, nursing homes need the PPEs, and first responders need them. So it's the same problems that have not been resolved by this federal government.
Right. And the tests are free, right? Regardless of if they do a walk-in, if they do the scheduled appointment, the COVID tests are free for everybody, right?
Yeah, the one at the Cure Arena on the 23rd will be free. The one that we're about to announce, we hope it's going to be at Unity Park, will be free. Yeah.
Okay. Okay. Very good. All right. Thomas, do you have any final questions about COVID for the mayor before we close up today?
Not at all. Mayor, keep doing what you're doing. You're doing a wonderful job.
Thanks, Thomas. You too, as well.
I'm just surprised. I'm honored that Thomas is here because, like I said, he is always. People will often ask, right? It's you. It's not him. I'm like, no. He really is a person. He is the man that is out there in the streets covering all of that, all of the stuff that's happening. Like I said, so that Peterson's can try to bring it to you first, bring it to you accurate, so that everybody knows exactly what's going on in the city of Trenton and in some of the surrounding areas too. So we thank you again, Thomas, for taking your time out today. Mayor, any closing words for everyone that's watching today?
Stay safe. Don't, you know, the bars and the restaurants are going to be closed at 10 p.m. starting tomorrow night, and have a safe Thanksgiving. Please do not open it up to extended family. Keep your group small, and hopefully the virus will be coming around the corner. I mean, the vaccine will be coming around the corner, so we can truly put this to bed.
Right. You know what though? Now, speaking to the vaccine, I do have one more question. So when the vaccine comes, right? When the vaccine comes, how then will distribution of that work? I mean, you know, because you're going to have people knocking the door down, possibly. Well, first you'd have some people that would say, well, you go ahead and try it on them and let me see what happens, right? Then you'd have the people that would then come and like knock the door down. How are they going to be distributing vaccines to the different cities or the locations and stuff? How will that work?
We are starting to put the protocol in place. You know, it really depends on supply, and the latest information is it has to be stored at minus 75 degrees. So government is going to be a huge player. We may do it through the schools. We may do it at firehouses.
Okay.
We're starting to get the protocols in place, and there's no guarantees how many vaccines will be given to the city of Trenton. I mean, you have. But
that's what I mean. That's like, yeah. And what is that based on?
So what we're doing is setting up the protocols. We're considering that we will be one of the locales that will have the vaccine for distribution. We just need to have protocols in place so that we could just say, oh, the boxes arrived, let us start, and we prioritize it. You know, obviously we want the hospitals to get it, the nursing homes to get it, first responders, the seniors, most vulnerable population get it. You know, we're establishing those protocols right now.
Okay. Okay, cool. Listen, everybody, it's been a great time. Thank you, Mayor Gusciora, for meeting with us for our moment with the mayor. Thank you for having Yvette come on with us today, your health officer, to talk and shed light from her perspective, from the medical perspective, about what happened. Rachel Cogsville, she's been putting a lot of comments and some good commentary in the chat, but I just caught, she says, as always, thank you, Mayor Crystal. She said, and wow, it's Thomas. So yes, Rachel, he is here in living color. And so let me give a plug real quick. Next Saturday, the 21st of November, there are several of us that are joining in Unity Square Park from 10 to 1 p.m. We are doing a Thanksgiving meal for those in need. So it's Project Move. It's the Top Ladies of Distinction Trenton chapter and Peterson's Breaking News. We've all joined together. We're looking to give out 300 meals to families. Also, it's going to be hot meals too. So also we have Change Church that's going to be giving out food boxes in the park as well. So people can come and get a nice hot meal, and then they can also get a box of food to take with them as well on the 21st, Unity Square Park. It's the old Columbus Park on Hamilton Avenue in Trenton, and that will be from 10 a.m. to 1 p.m. So if you or you know somebody that is in need, please come out and take part in what's going on with that, right? And you'll even see Thomas there too, because he's going to be there with us on that day participating, right? And if the mayor has time, he's going to swing by too, and help to pass out, a plate or two. But it'll be a good day in the community. That's what it's all about. Social distancing, mask wearing, all of that going on. But you know what? People are still in need, and we still want to be able to help them, especially during these hard times. Again, Mayor, thank you so much for coming out, for joining us. Everybody who's been watching, thank you for tuning in once again to Peterson's Breaking News of Trenton, New Jersey. We have Thomas Peterson here himself. Shout out to Andrew Bobbitt with the Office of Citizens Concerns for the City of Trenton for making this happen. We are very appreciative for the opportunity. And again, to all of our followers and supporters, thank you to each and every one of you, because without you all, there would be no Peterson's Breaking News. So we appreciate you and continue to look forward to bringing you the latest and greatest news in Trenton and the surrounding area. Everybody have a great day. Until the next time.
Thanks.
Take care. Thank you.